Yes, sir.
You should keep his number and so on. I mean, he is in charge of the international division.
Acha, interesting.
Yes.
Last time दूसरे थे ना, there was somebody else. Last time.
Where did you get
From the hotel?
Yeah, we missed it.
7, 8
Do you have breakfast eventually?
No, he was the
Wait, you had breakfast when they came?
He is in charge of, he is the vice president for international division.
Oh, wonderful.
That's the reason I involved him, so that
It's always good to like.
yeah, he will be comfortable and they will be in a position to find out or meet somewhere sometime.
He is one of the Mr. Lance too.
Okay.
He is from Brunei.
Nice to meet you, sir.
Asking like whether the government pays or whether the patients themselves.
Yeah.
We'll address all these during your
Issues,
Presentation.
after these. Yeah.
No worries.
Please.
Thank you. Thank you.
Come on. Thanks.
So this is the 6th floor.
Sure. Thank you.
The 6th floor right now.
Thank you.
So we'll
Thank you.
brief information on this brochure.
Oh, thank you, sir.
So here we have an inpatient ward and we have our telemedicine center. So to show you the telemedicine center, the idea is from this center we connect to the whole. Yeah, we do a lot of conferencing, lot of educational programs, lot of OPD. If somebody is in the rural or outside India, so we can connect them to the daily.
All these are accessories.
It's like
So make it look
teleconference
so
checkups.
Correct. Teleconference. So audio video conference with the doctors, with the lecturers.
Factor this thing, no?
We have
okay.
the biggest network of the tele-ECG. Tele-ECG, we are running like in the rural areas. Like right now we have like 800 like rural areas which are connected to the center. So what we do from here, sometimes in the village, suppose a patient who is having a chest pain, okay, there we don't have the cardiologist. So a general practitioner will be there. We have equipped those centers with some technical support, and we have connect those centers with this center. So when a patient comes in, he put the ECG, and that ECG will reflect in our system over here. And we have a dedicated team of doctors who is replying to those investigations.
So the machinery are in the rural areas?
Yeah.
And then it gets relayed back here?
Correct. Because they don't have the doctors, cardiologists in the rural area. So we will brief you more with the live.
That sounds good.
So this particular whole building is only for one specialty, only for cardiac. We have 5 cath labs and 1 hybrid cath lab, 6 cath labs in this hospital. So as sir has told that we are doing around 30-35 open heart surgeries in a day. So it is a massive volume. We have around 20 plus OTs only for the cardiac surgeries.
How many doctors are on duty on any given day?
On duty we have more than 50 consultants who are right now, you have seen the ground floor and the first floor.
Yeah.
They are right now engaged in the OPD.
Okay.
So we have 2 sets of OPD programs right now. One is for the general public, one is for the executive OPD we have. So the people who can afford little more, they have that, we have more better services for them. So we have all categories of patients, flow is there. We have patients from the insurance, self-paid, from the government.
Do you have a VIP floor?
Yeah,
You do?
we have.
Okay.
We will show you. Come. So at present, Narayana has
Don't worry.
hospitals in India, and we have one hospital in Cayman Island in North America. We have approximate 30 plus hospitals at the moment. We have a total bed strength of 7,000 beds we have all together. So this is one of the hospital in the Kolkata. It is one of the oldest centers. So this one is well known for the cardiac and the renal transplants we do. Kidney transplants.
The medical procedures that you're providing is obviously quite state of the art right now. Are there any, has any ASEAN member countries sent any of their patients here?
We have treated
Yes.
more than 79 countries' patients
Yes.
till now.
Okay.
We have an inflow of more than 1,000 patients from the overseas every month.
Yes, okay.
Yeah. So you can see here, we have treated more than 76 countries' patients.
But in specific, like the people from ASEAN, like
We are
Singapore,
getting
Thailand.
we are getting more of from Malaysia.
Okay.
From we are getting batches for the especially for the pediatric cardiac.
Just asking, is it from the government hospitals itself or private patients are coming here?
It is a kind. We are supporting a lot of NGOs.
Okay.
We are connected with so many NGOs from Iraq, from Malaysia, from Bangladesh. So the majority of patients we get is from the highest number is from the Bangladesh.
Interesting.
Apart
Okay.
from that, we are getting from Middle East
Okay.
and then African countries.
Understand.
SARC nations are less.
Yes, yes.
Yeah, and so
Yep.
all these countries we are getting.
Yep.
So the South Asian, ASEAN, Malaysia, you said.
Philippines we are getting. We are getting from Bangladesh, Singapore, Malaysia. Yeah, all these
Getting from
countries.
Brunei, Indonesia.
Indonesia we are getting. We have done the bone marrow transplant for the Indonesian
Vietnam.
patients. Vietnam we are getting. Myanmar. Yeah.
For my
The flow is
understanding-
not that great because we have
Yeah.
not yet explored much in those markets.
Yes, yes, yes.
The reason is
I
that.
understand. Because at the
If we
moment
will
I
educate
think-
people more people will come because our costing is cheaper than the
That's
other
right.
hospital. And we have the best outcomes as well.
I see. I think among ASEAN member countries right now, Changi General Hospital, that's the one where most of the centers are, most of the heart cases are being referred to. Thailand also has upgraded its health tourism.
Yeah.
Something like that. So, is there anything that India can do to perhaps encourage
Thailand
more?
came before India in medical
I see.
tourism.
I see.
But India right now they are leading
In terms
the
of
medical tourism.
in terms of outcomes.
Yeah, outcomes we have far better.
Okay.
And the costing in comparison to
Of course.
Thailand, we are like 1/3.
Wow. Okay.
Yeah.
Very interesting.
Like in kidney transplant,
Very
we
interesting.
can do the kidney transplant in $10,000. While the same will be in Bangkok, Thailand,
That's right.
you will get in $40,000
Understand.
minimum.
And USA will be more.
10 times.
So you can buy 10 kidneys. so one for me, one for all my friends. But we understand the costing. That's
Yeah.
the price advantage point.
Costing and the delivery of the healthcare is far better.
May I ask, how long has this center been?
Since 2001. we are
2001.
operational.
Okay. All right.
So you can see in the
Yes, yes.
brochure, like right now,
Yes.
we have already hospital placed in Cayman Island in North America.
Yep.
It is already functional from past 2.5 years. So these are the few hospitals which we have put it on the brochure. This is in the North America.
Okay.
This
I
is the
see.
Bangalore facility. This is a JCI accredited hospital. This is the highest accreditation in the healthcare.
Okay.
Yeah. So this one is also JCI. This one is also JCI.
I see.
Yeah. So this is a Health City campus is of
Yes.
like we have a big campus. This one we have all the specialities under
Yes.
one roof.
I see.
We are doing bone marrow transplant, heart transplant. We have done almost 56 heart transplant in this hospital. So we are one of the pioneer in that. Yeah.
I imagine that because you set yourself as a hospital, a big hospital that's affordable, big cardiac center that's affordable. I imagine that you have patients that are from the lower classes from all around the countries. And do you run into any language barriers or even knowledge barriers or cultural barriers?
Language barrier is not there. We have our in-house translators for the patient.
In-house?
Yeah, in-house. Like Arabic, French, Portuguese, Swahili. So all those translators we have in-house.
Are they also medical professionals or just translators?
They are translators, majority of them. Some of them are medical professionals.
Okay.
Plus we are running a series of academic programs. Right now we have more than 80 courses we are offering to the Indian students and people from outside, anywhere from the world. They can come over here. We have a series of courses. We have a diploma courses, we have a PG courses for the doctors, fellowship program for the doctors. So right now we have like a batch of 40 plus students, doctors and some paramedics from Ethiopia. Yeah, they are undergoing that program, 3 years fellowship programs. Yeah. Ethiopia, from Nigeria, from Tanzania, Kenya. From these countries we are getting more numbers. So we can provide the customized training programs for the doctors. If somebody is interested for the hands-on training or any academic full-time course, we have. So we will brief you on what all we are doing over here. So as we have told you, we are running a TT-ECG program. It's a satellite ECG which we are getting the reports over here. We are reporting almost 900 to 1000 reports per day. And the TAT for this reporting is less than 10 minutes. So if a person who is in the village area, he will just lie down on the bed, get his ECG done. By the time he will wear the shirt, he will have the report in hand. Okay, so sometimes, there are a lot of life savings can be done with this. Because those areas, they don't have that kind of doctors availability.
But what equipment do they use in?
So right now we have 2-3 models. Like we have Android-based applications.
Okay.
So this is the machine which will connect your ECG machine and your system. Okay. So this machine will transform the images to the system, and after that, with the help of the internet, just with a one push, you can get the image in our server. So we have a dedicated team of doctors. They are sitting in their desk. The same system they can access from there. So every moment they are reporting. Sir, एक बार दिखाएंगे एक बार demo. एक reporting format, like how we report. So within minutes, sometimes fractions of seconds, even we are doing the reporting.
This is the timing. Within the time, sometimes 0 second, 1 minute.
Yeah.
Within 1 minute, they will.
So they are live. Doctors are live right now.
Yeah.
They get the report.
See,
Immediately they will give the feedback.
Coming now.
Yeah,
See, now one issue is coming. Just they upload it from there itself, and then they will report it.
What's your margin of error for like these things?
Huh?
Margin of error for like.
Margin of error. See, ECG reporting error, because we have a good cardiologist sitting for this reporting. Okay, they are good experienced, more than like 5-10 years experience they have. So error margin is very less. Yeah. Until and unless the reporting, the report generated by the machine is okay. Error margin is everywhere.
Yeah, of course.
Does like long distance reporting of like the ECG does that add to like the difficulty of or the margin of error as you said? or is it the same as collecting data here directly?
Yeah, because everything is checked and very well checked. This software, this machines, all we have installed. Yeah, we do lot of first repeating of the reportings, so that there should not be an error. Okay, it's a matter of a life.
Right.
Yeah.
Exactly.
So a lot of research they do on that part, and after that only these installations can be done.
So the equipment themselves are of the highest standard.
Yeah, highest. We are upgrading it time to time. Right now we are the latest with the Android. Like doctor need not to sit in front of the desktop.
Okay.
They are getting on the mobile, on the handset, tablet form. Yeah. So if he is traveling somewhere, he will get immediately. So we are keep on upgrading the technology.